And welcome back. Well, today, important information that everyone should know about gum disease. If you have an unhealthy mouth, it can be bad for your overall health.
Dr. Roberto Monteagudo and Dr. Christopher Hickson are here with WisconsinSmiles with more on that. Great to see you guys.
Nice to see you guys again.
Thank you so much. Let's talk about gum disease, periodontal disease. What is it? Because it seems like you hear about it all the time, but I'm not sure if people know what it is.
Go ahead.
Well, first of all, gum disease, there's two stages. There's gingivitis stage, which the great thing about gingivitis is at least that's reversible. The second stage, if you leave gingivitis untreated, develops into periodontitis, which is basically a bone and ligament deterioration of the jaw. And if that's left untreated, then you have predisposed factors that can hurt you.
Is that what they test when they use the little pick to see how deep your gum goes at
Correct.
the dentist?
Yeah.
Okay.
What we do at those visits are that we, other than just a cleaning, we want to see how the health of the tissue is around the tooth. For people that have had the procedure done, you'll hear the dentist or the hygienist say measurement, 1, 2, 3. Anything over 3, let's say it's a 4, it's usually considered gingivitis. It's the start of an infection. Anything over 4, 5, 6, 7, it's a concern. Okay, and so one of the things we want to do here today is educate your viewers and the public of the importance of having a healthy mouth, because research has now shown that not having a healthy mouth will contribute to other health issues. For example, somebody that has periodontal disease is at a higher risk of having a heart attack. There's some really scary statistics. Respiratory disease, strokes, premature births, low birth weights. I mean,
diabetes is a big one.
Yeah, and diabetes is huge. Anybody who has diabetes, they really have to monitor their oral health, because if not, number one, it could worsen the diabetes, and diabetes medications may not work as well, but also people that have diabetes tend to have a higher grade of gum disease. So it's very, very important that they go to the dentist.
What are the stages of gum disease? Because you talked about gingivitis. That's kind of it. That's like the precursor to it, right?
That's correct. That's correct. Yep. And then gingivitis left untreated then can develop into periodontitis.
And that's not reversible.
That is not reversible. That's correct. And like he was saying with the measurements and stuff, that's one of the indications that you have. So there's predisposed factors that also play a role in the periodontitis. Age is one. 75% of all Americans over 65 have periodontal disease. Wow. So that's a high number. You have genetics, you have medications, what else am I forgetting?
Yeah, smoking.
Smoking,
you know,
tobacco use is huge.
Yeah, so you know, and like you said, it's a very huge number, and that's the big concern. And you know, when we see commercials on TV, we see a lot of commercials about toothpaste and how white your teeth can get. But they seem to lack information on this health issue. For example, let's say you woke up in the morning and you scratched your ear or your nose and it started bleeding, or it was a little puffy. You would go to the medical doctor immediately, find out what's going on. There are millions and millions of Americans right now that wake up in the morning, they brush their teeth, they floss their teeth, there's blood coming out of their gums, and they think it's okay. It is not okay.
So
okay?
it's not normal.
No, it's not normal.
Right.
It's not normal.
So people think, okay, is flossing, is you know, using mouthwash, is that enough? Will that reverse gum disease?
Gum disease can be reversed. You can reverse the gingivitis.
With those things?
With those things,
and
along with seeing the dentist. It's really important because they can get to things that sometimes you can't get to. And so the combination, we all have to work together. But yes, if you're brushing and flossing regularly and seeing your dentist regularly, those are the...
What do you guys brought some things that we always see at the dentist's office,
Sure.
a toothbrush, some mouthwash. What do you like about a water flosser?
Well, you have here the usual suspects. You have, you know, you have the toothbrush, you have the toothpaste, and the floss. What a lot of people don't know is that the pocket around your tooth is actually U-shaped. So when you put your floss in, it only goes to a certain point. Okay, so there's usually, especially if you have gum disease or periodontal disease, there's usually a deeper pocket. The floss doesn't get underneath there. So if you could imagine flossing, but there's still underneath your, like pockets in your pants, or there's still some bacteria underneath there, the water flosser works really, really well in getting into that pocket and just swishing everything out. And if you combine it with a little bit of Listerine or something, it's even better.
So you use it how? You brush, you floss, then you water floss.
Yes, you brush first, floss, and after you floss, then use a water flosser with a little bit of mouthwash, and
And you're good to
it's
go.
an adjunct, it's an aid. You know, you don't want people to understand that oh, if I use the water flosser, I don't have to floss. That's
Right.
not exactly it. You have to use them in conjunction. They help each other.
What
Okay.
about fillings that fail and crowns
Yeah.
that become problematic? You can develop
Yeah.
problems from that as well, right?
Yeah, you know, one of the biggest, I think, errors that we've done in dentistry is say that, you know, this is a permanent filling. Everything wears down. Okay, it's fillings wear down, crowns wear down. The only thing that really we have almost permanent in dentistry are implants now. But when it comes to fillings, crowns, and other restorations, they wear down just like the tires of your car or anything like that. So it's very important that we constantly monitor these fillings, because if not, if they start leaking, then saliva and bacteria gets underneath the tooth and starts, we've heard the term rotting the tooth away. That's exactly what's happening. You have a whole host of bacteria that they're just swishing all over the place. It's not healthy at all. What I tell my patients usually is, you know, if you're looking at your house and you have a leak in the roof, one of the shingles are coming off, okay, you're going to go have it replaced. Well, if you have a filling that's leaking, you should have it replaced.
Right. Absolutely. Well, I think it's great that right now you guys care a lot. You're doing free consultations for your oral health consultation. It's a $75 value right now. It's a comprehensive dental exam as well for $40, and that includes your x-rays and cleanings, which is a $312 value. So here's how you can take advantage of all that free stuff and the wonderful comprehensive dental exam with your x-rays and cleaning for $40. Just contact Wisconsin Smiles. They're wisconsinsmiles.com, or you can go to their location at 70th Street, in West Allis, or call them to make an appointment at 414-982-3676. This is your time to take advantage of it for a really great discount. Thanks so much, you guys.
You bet. Thank you.
Yeah, it's
Yeah,
always
nice
a pleasure.
to see you guys
Thanks.
again.
You bet.
Thank you so much.